Hello, everyone. Today we are at the Thunder Bay Health Sciences Center with Dr. Harris, who is a general surgeon here. And Dr. Harris is going to talk to us a little bit about the fact that March is Colon Cancer Awareness Month. Thank you so much, Dr. Harris, for taking time out to talk to us today.
Okay, thank you.
We're all interested to hear about these fecal occult blood test kits that help screen for colon cancer. Could you tell us a little bit about how they work?
Sure. Well, as people may or may not be aware, colon cancer is a very common form of cancer in our population. It also is a very treatable form of cancer, and one that we're able to detect in the earliest stages and possibly even before it becomes a cancer. There's various ways to actually screen for it, and the one that most people are familiar with is a colonoscopy, which is a test where we put a scope into the colon and we look for cancer or precancerous areas. What people may not be aware of is there is a much simpler test with essentially no risk at all that the government is promoting, and that's fecal occult blood testing. And that is this here. And it works on the principle that cancer or spots that aren't yet cancer will often weep a little bit of blood. And this would be a minute amount of blood that you wouldn't even be able to see. And these tests detect that, and if it comes back as negative, then it's highly unlikely that you have a cancer or anything of concern, and no further testing is required for that year. Whereas if it comes back as positive, then there is a slightly increased chance that there's something there, and then we would go ahead and do a colonoscopy to look and see if there's something there for real. So the way it works is that it identifies the people that really would benefit from a colonoscopy and try to spare a lot of people from going through an invasive test.
Sounds fascinating, and it's painless, and it's something that people can do at home, correct?
It's absolutely painless. It is people do sometimes get a little squeamish about it, and there is a little bit of gross factor to it for sure. But the way it works is that you need 3 samples, so on 3 different times after bowel movements, you would get a very small sample, and the kit comes with small sticks to take it, and you put it on this, and then there's a very special envelope you put it in, and you mail it back to the lab where they will test it. And then they'll get back to you and the doctor that ordered it as to whether there was anything there or not.
So, Dr. Harris, there's no cost to people to participate in these tests. No. And how does one go about getting one of these tests?
You can bring it up with your either family physician or a nurse practitioner that's looking after you, and they should have all the information and have the kits available and can arrange it for you.
Excellent. I also read that if you don't have a healthcare provider, that you can call Telehealth Ontario and they will assist. That sounds wonderful. It sounds like a very non-invasive procedure and something that everybody should take part in. What is the age category? Who do you recommend should take the test?
Right now, recommendations are that everybody between 50 and 74 should get some form of screening. Now, it's not the same. If you have a strong family history of colon cancer, then that changes things, and you might want to bring that up with your care provider. Also, if you are having symptoms, for instance, if you're having rectal bleeding or your bowel habits are changed or you're having abdominal pain you didn't have before, then I wouldn't go with one of these. I would bring that up with your provider. Another test may be necessary.
Fantastic. Well, again, we sure do appreciate you talking to us today. Sounds wonderful and a great way to prevent stuff happening.
Great.
Awesome. For Go, I'm Carrie Burr.